Chlamydia. What to know? Chlamydia is a sexually transmitted bacterial infection. It affects both men and women and is spread during sexual contact. According to the Centers for Disease Control and Prevention or CDC, in 2015 there were over 1.5 million cases of chlamydia in the United States, a rate of 478.8 cases per 1 lakh population, which has been increasing since 2001. Since 1994, chlamydia has been the most common sexually transmitted infection reported to the CDC. Symptoms. Although most people with chlamydia do not exhibit symptoms, they may start to appear 5 to 10 days after contracting the infection. Chlamydia symptoms in women. This may include abdominal pain, large quantities of vaginal discharge that may be foul smelling and yellow, bleeding between periods, low-grade fever, painful intercourse, bleeding after intercourse, burning with urination, swelling in the vagina or around the anus, needing to urinate more often or discomfort with urinating. Chlamydia symptoms in men. This may include pain and burning with urination, penile discharge, pus, watery or milky discharge, testicle swelling and tenderness. If the rectum is affected in men or women, it can cause anal irritation. Most people, though, have no symptoms at all. Treatment. Treatment of chlamydia is very important because if left untreated, it can cause long-term health consequences including infertility and ectopic pregnancy. Antibiotics are effective in treating chlamydia if the patient follow the doctor's instructions. In most cases, they will be in pill form. Repeat testing 3 to 4 months after treatment may be recommended, depending on risk factors. Some people might experience side effects after taking antibiotics, including diarrhea, stomach pain, gastrointestinal issues, nausea. In most cases, the side effects will be mild. Treatment of men is equally as important. If it is left untreated, chlamydia can lead to epididymitis and reactive arthritis. Depending on the test used to diagnose chlamydia, a person may also be treated for gonorrhea because these two bacteria often occur together. Causes. Chlamydia may be transmitted by unprotected oral, anal or vaginal sex with a person. Genital contact with can also pass on chlamydia. As chlamydial infection presents no symptoms in at least 70% of carriers, an infected person may pass it on to their sexual partner without knowing. Chlamydia cannot be transmitted through contact with a toilet seat that has been used by an infected person, sharing a sauna with infected people, sharing a swimming pool with infected people, touching a surface that an infected person had previously touched or coughed, sneezed on, standing close to an infected person, inhaling the air after they have coughed or sneezed, sharing an office with an infected colleague. An infected mother can pass the infection on to her baby during childbirth. Sometimes the infection leads to complications for the infant such as pneumonia. If a mother has a chlamydia infection during pregnancy, she will require a test 3 to 4 weeks after treatment to ensure the infection has not returned. Prevention. Prevention methods include condoms, using a dental dam during oral sex, regular screening. To avoid spreading chlamydia, Individuals should avoid sexual activity until treatment is complete. If a one-time dose of antibiotics is prescribed, it is recommended that people avoid sex until 7 to 10 days after treatment. Complications. Early diagnosis and treatment greatly reduce the risk of complications. Complications can be prevented with regular screening or by seeking medical attention as soon as symptoms appear. Complications of chlamydia in women include pelvic inflammatory disease or PID. This is an infection of the ovaries, fallopian tubes, and uterus that can lead to infertility. Approximately 10 to 15% of women will develop PID if chlamydia is untreated. Cervicitis. This is an inflammation of the neck of the womb. Salpingitis. This is an inflammation of the fallopian tubes. There is a significantly increased risk of ectopic pregnancy. Complications of chlamydia in men include urethritis. The urethra, a tube which carries urine from the bladder to the end of the penis, becomes inflamed. Epididymitis. This is an inflammation of the epididymis, a structure inside the scrotum. Signs and symptoms include red, swollen, and warm scrotum, testicle pain, and tenderness. Reactive arthritis is a possible complication of chlamydia and can affect both men and women. It is a chronic type of inflammatory arthritis. This can include arthritis, conjunctivitis, and inflammation of the genital, urinary, and gastrointestinal systems. The complications of chlamydia are potentially serious, so treatment and screening are very important.